So this brings us to the next slide. We're all clinicians and we want to know what is new and what is going to happen in the very near future in the field of low vision. And so we come to another exciting section of this talk. And the first thing that we should know is that these special contact lenses, which offer a magnification of 2.8x, are available, not exactly available, they are being researched by the US military. And they are PMMA lenses, which is central 2.4 millimeter hole through which a patient has normal vision. And then when you put a polarizing glass in front of the eye, as you can see over here in the bottom, then what happens is that you have these diffraction rings all around the central hole. So when you put a polarizing filter in front of this contact lens, then the pathway of light coming into the lens is changed to the periphery on the sides over here and passes through this refractive rings. And when they pass through the refractive rings, a magnification of 2.8x is produced on the retina. So, and once you take off the polarizing lenses, then once again the patient gets normal 1x vision. So those were only experimental devices meant for use by US military. It won't be available in commercial market for quite some time now. And this is a very small spectacle mounted device made by an Israeli company called Orcam, and it uses artificial intelligence and augmented reality to capture images from the environment via a small spectacle mounted camera over here. And it reads out menu charts and whatever is present in the environment, also produces a magnified image of what you see. So it's a very handy, portable, small, high resolution device. Now, implantable telescopes, miniature telescopes, have been around for about more than 2 decades now, but they were FDA approved only in 2010. And since very few people implant them worldwide, it is interesting to learn a little bit more about them. They are these thick Galilean telescopes which have been miniaturized and can be implanted in patients' eyes. The only thing to remember is that you can only implant it in one eye because the other eye has to be used for peripheral vision and navigation with the peripheral vision which is present in that eye. And in one eye, you can implant this telescope to give you magnification. And these are used for patients who've got very poor vision, like 20/800. They can be implanted only unilaterally in cases of age-related macular degeneration. Now, an improvement over the IMT is the Lipschitz mirror implant, which works on the principle of the Cassegrain telescope. As you can see here, there are 2 mirrors in this kind of telescope to produce magnification. And this implant is much smaller than the IMT, and it's got 2 mirrors, and this is the central aperture through which light enters. The periphery is regular and optically neutral so that peripheral vision is maintained, and the central area provides the magnified image. So it has got dual optics in a way, and a lens can be implanted in both the eyes bilaterally in contrast to the previous one. And we are going to skip this because this is just a schematic to show you how it looks like when it is implanted in the patient's eye. And the latest kid on the block is the Scharioth's macular lens. It is a foldable bifocal lens which is implanted in the ciliary sulcus over an existing lens. So if a patient has AMD and cannot do near tasks beautifully, you can implant this lens. It has got an optical zone which has got a dioptric correction or dioptric addition of +10 diopters. So it produces magnified image for near tasks like reading and writing. Then from the realm of science fiction, we now come into the age where bionic eye has become a real life thing. And the Argus 2 Epiretinal implant by Humayun and Group is one of the most popular actually commercially available epiretinal implants. And what actually is done is that here there is a small camera which is mounted on a spectacle, and it captures images from the environment and sends it to this video processing unit which a patient can keep in his pocket. And signals from here are sent into this antenna, which transmits it wirelessly to a device mounted on the equator of the patient's eye. And from here, the signals go into an epiretinal implant. This implant has about 60 electrodes which are impinging upon the epiretina, and when they are stimulated, they produce phosphines. So vision in the form of phosphines are presented to the patient, and the patient is able to recognize objects in pixelated form or phosphine form, and it takes about 2 to 3 seconds to recognize an object. So these are some experiments which they did with the epiretinal implant. They have got a huge number of patients now, and this is the epiretinal implant in place, and this is the experimental setup where patients were able to identify letters and small size letters also. They could recognize written words, and letters as high as 9 millimeters could be read at 30 centimeter distances, and some patients could also read unrehearsed words. So this is really very impressive. Now work is going on to improve the resolution of the Argus 2 implant, and they are going to come up with Argus 3 soon. And the idea is to improve the number of electrodes from 60 to about 1,000 electrodes, and improve the resolution from 60 pixels to about 200 pixels, and go from phosphine vision to actual facial recognition. So this is sometime in the future. Work is going on for the last 4 or 5 years. Let us see what they come up with in the future. Now there's a group which has succeeded in using induced pluripotent stem cells to produce three-dimensional retinal cup with all 10 layers, and they've grown this in a culture in a petri dish, and they have functional photoreceptors in them. So this is really very exciting research which is being done, and sometime in the future we could also have actual retinas with all 10 layers intact implanted in a patient's eye who's got profound visual loss, even no PL vision or PL vision only. Now there's another group which has done gene therapy and transferred genes into rodents who were blind congenitally, and they have succeeded in transforming the neural cells of the retina into becoming rod cells. So this is really exciting. Sometime in the future, maybe 10 years or 15 years down the line, we might have double gene therapy for human candidates also who have congenital stationary night blindness or retinitis pigmentosa, so that they're able to see better. So you might have seen the movie Terminator and its sequel, where a lot of cyborgs populate the film world, and with all the experimentations which are being done now in the field of low vision, we are not far when we will also be cyborgs so far as visual impairment and correction of low vision is concerned. Thank you very much for your attention. And if there are any questions, we are ready to take them now. Thank you.